Like to welcome everyone to the September 21st, 2023 meeting of the Developmental Disability Advisory Council. Before we start, by the way, my name is Nick Cappoletti, for those of you who don't know me. Before we start, just a little bit of housekeeping. As you're well aware, the meeting is being held this morning at 3 locations, all open to the public per the open meetings law. In addition, we have people participating virtually. A copy of the video for this meeting will be posted to the DDAC page on the OPWDD website. The primary location of the meeting is in the Empire State Plaza. We have locations in New York City at the Center for Family Support and in Buffalo at People Inc. In Williamsville. I'd like to thank the 2 hosting organizations for providing their locations to us. And I want to thank everybody for coming this morning. Given the challenges of conducting a live meeting from 3 different locations, along with virtual participation, I would ask everyone that when they do speak or respond to identify themselves so that we have it for the record and for the video. Before we begin, I'd like to do a roll call of DDAC members, and then we'll acknowledge the presence of PWDD staff. So if we could, we'll start with Buffalo. Well, I'll start with names, and then if you could just identify what location you're at, and if obviously you're on the call. So Shamika Andrews, Jerry Athanas, Dan Brown.
Virtual.
Hi, Dan. Janice Chisholm.
Good morning, joining you virtually.
Thank you. Donna Kalana.
Hi, Nick, in New York City.
Very good. Hi, Donna. Barb, we know you're on in Buffalo. Randy D'Antonio. Stuart.
Hi, Nick. It's I'm with I'm at CFS in New York City.
Very good. Thanks, Stuart. Jeffrey Fox. Barry Goldstein. Susan Hetherington.
Buffalo.
Luana Jones.
I'm gonna go. Okay.
Paul Joslin. Suzanne.
Good morning.
Good morning. John Maltby.
In New York City.
Dolores McFadden.
Here.
Deborah McGinnis.
Here.
Melissa Miller.
Good morning, I'm virtual.
Morning, Missy. Robert Petofsky. Randy Rios Castro. Kai Roman. Sumantra. Helena Schmidt. Michael C. Ryder. Stephanie Speaker. Leah Steinberg. Okay, she is on. Very good. Virtually or at one? Virtually. Okay. Valeria Valdez. Meyer Werthammer. Is there anybody representing Family Support Services?
Yes, Kathy Nowak, virtually.
Thanks, Kathy. Welcome.
Thank you.
Melissa Stickle.
Virtually.
Good. And I don't think Vicky's with us because I think they have a meeting today. Vicky, you're not on. Okay. Very good. All right. Thank you very much. You know, I did receive some questions about virtual versus being present at one of the locations. And I do want to make a clarification, and we did seek information from OPWDD Council. I know we passed a resolution in the last meeting that allowed virtual participation, but I need to remind the members that for the purposes of establishing a quorum, transacting DDAC business, that we do need a quorum in the open meeting locations. So right now we have 3 open meeting locations. We're going to work towards the next meeting, maybe adding another 1 or 2 just to ensure that we do get a quorum that can transact business. Okay. But again, thank you all for coming.
We have a quorum today.
So I'll do the math and let you know. I've got to just quick. We were close. I'd like to welcome Commissioner Neifeld, and I'd like to hear present in at the Empire State Plaza. We're joined by Allison McCarthy, Jessica Pigeon. Are there any other OPWD staff joining us today?
We do have quite a few staff
Okay.
members. Sorry, we've got quite a few staff members on virtually. Willow Bear, our executive deputy commissioner, is on virtually. And then all of the representatives, I'm not going to go through the list because I will just forget someone and that would be terrible.
Okay.
But all the representatives of our committees are on both from the policy and program side. And then also many members, I can't see the list, but I'm sure that there's many members of leadership that typically join virtually. So we do have several folks on.
Very good. Thank you. Okay, let's view the agenda. Slide. So I know we're a little bit behind here. First of all, I'll ask for a motion to approve the minutes for the last meeting. John Maltby, the vice chair, is going to do a quick overview of DDAC and some changes that we recently made. We'll then ask the commissioner to provide us with an OPWDD update and allow some time for discussion. We're then going to go into committee reports. We have 4 committees that are reporting today. And we'll take a short 10-minute break in between those reports. We'll allow for discussion. And then we'll allow time for public comment. Okay, so that's our agenda for today. First of all, we did send out the meeting minutes from the last meeting. I'd like a motion to approve those minutes.
Moved.
Thanks, Jeff.
Yep.
Second, Sumantra, all in favor?
Aye.
Very good, thank you. All right. Okay, so we can turn it over to John. You know, do just a quick overview of some things.
Sure. Thanks, Nick. Given the time that we're starting, I'll be brief. But it's important that folks who are joining us, some of you for the first time, understand who we are and what we do. The DDAC was put together through legislation in the mental hygiene law and has 3 very specific tasks. The first one is to review all proposed regulations. So that doesn't mean administrative memos, it doesn't mean laws, but it does mean having recommendations about proposed regulations. The council should also assist the commissioner with the development and assessment of the 507 plan, which we did over the course of the last couple of years, and we'll probably hear from Allison and Jessica about their feedback in terms of the various focus groups that they created to follow up on that. And the council shall periodically assess the local planning process and make recommendations on that to the commissioner and the council for mental hygiene planning. Next slide, please, Josie. Most of the work that gets done in the committees who meet in between the public sessions. We'll see all of the committees later on in today's session. But it's a good way for folks to get introduced to the work of the DDAC. The heads of the chairs of each of the committees are members of the council. But we bring in a lot of outside experts, subject matter experts, family members, and others who are interested in working on the committees. And they don't have to be a member of the council, but they do have to show up and help with the work. So we have a series of committees which you'll hear from later. The committees are focused on best practices, how to help our systems relate better to the people that we support, and other matters, including planning. But we're very much conscious of the fact that while many of us are family members, our committees are not a forum for discussion of individual issues, but are a way for us to help to advise and influence policy. Next slide, please. And here are the committees. So we have the Residential Committee, which you'll hear from today, the Health and Wellness, Systems, Self-Direction, and we'll hear from Stuart, who's with me here in the city. The Children's Committee, which we are just launching, and we'll touch on that later, and Employment and Meaningful Activities for Adults. Sometimes we'll form subcommittees to address a particular issue that arises. They are going to be of sort of limited duration, focused on one particular subject. We often will interact with the counterparts at OPWDD to try and find a way through a particular issue at the subcommittee level. We then bring those issues to the full committees, and then they in turn forward them to the full council to be discussed or addressed in the public meetings. Next slide, please. Excuse me. So who are the people that are involved? So the appointments are made by the Governor's Office with the recommendations of OPWDD, but in addition, there are 4 members appointed by the Senate and 4 members appointed by the members of the Assembly. Of a possible 33 members, we now have 29, of which 23 were appointed by the Governor, 6 by legislators, and we have 4 vacant seats which are at the control of the Assembly. So we're looking to clarify that with the Appointments Committee. Most of the people who are on the council are themselves people with intellectual or developmental disabilities or family members of people who have an intellectual developmental disability, roughly 60%. And also about 60% of the members are professionals. So obviously that's 120%, but there's obviously a degree of crossover, which is not unusual in our field. Pretty much all of the members of the council are engaged in various committees, some on more than one. And we represent all of the regions in the state, from Montauk to Buffalo, but there is perhaps an historical concentration in the Capital District and region, excuse me, Region 3, partly because of the nature that of the of the work done by the council and by all of the counterparts that we interact with in the Capital District. As Nick said, our goal is to make sure that we have meetings in and representation in each of the 5 OPWDD districts and regions, and our plan is for the next meeting to include certainly people from Region 2 and Region 5 who do not have a site in today's meetings. So that's a top-down view of who we are, and I'll pass it back to you, Nick.
Thanks, John. And Gary, to answer your question, today we are short of a quorum by 3 members. So, but there are no votes that are going to be taken. So, okay, with that, I'll turn it over to the Commissioner.
Great. Good morning. I think it's still morning. Just about, yeah. Morning, everyone. It's great to be here. I missed a few of the council meetings while I was out, so I'm glad to be back and with you guys. And I'm really grateful to the work that happened while I was out. I know there was a lot of work around organizing the committees, ensuring that OPWDD had full representation from both strategic initiatives, policy, and program with each committee. And there's been a lot of discussion with the committees, with Nick and with John, around making sure that we're continuing to align in the work that we're doing, that the priorities of the council members are being reflected in OPWDD's work and vice versa, that OPWDD's priorities are being reflected in the work of the committees. and continuing to make sure that that feedback loop is going both ways, that there are recommendations coming and that there are responses and that there's also requests, right, from OPWDD for the committees to work on some of the issues that are most pressing to us. And I think we're seeing that today in John's presentation with the creation of some of the new committees or some of the subcommittees to really be, focused on some of the issues that are pressing us at a policy and operational level on a regular basis. Things like children, things like complex multi-system involvement. These are big issues that, we are attempting to tackle thoughtfully, and having your participation and your assistance in thinking that through, both from the self-advocate, from the family member, from the provider, and from the system perspective is really, really critical. So we're really looking forward to that, and we'll continue to refine our processes and make sure that that feedback loop is bi-directional, which is the goal. And I appreciate the overview, John, that you took the time to do that. I think it's always really helpful for us to remember and to reflect on that. I just want to emphasize, like Nick did, the continued importance of attendance at one of the open locations. We don't have business today, but it is important for us to conduct business, to have that quorum, and we will work to create additional locations. And certainly, if there are ways that we can be helpful, council members should let us know, and we'll continue to talk with Nick and John about how we can do that and continue to make the meeting more and more accessible. So I'll provide some general updates, and I'll go quickly because I know we started late, and then I'll turn it over to OSI, the Office of Strategic Initiatives, Allison and Jess, to talk to us about the recent activities related to the 507 plan. I think folks know that in July, we commemorated the anniversary of the Americans with Disabilities Act by launching a year-long anti-stigma campaign, and also showcasing the DDPC's documentary Remembering Willowbrook, and hosting our own exhibit in the Empire State Plaza here that was on display through Labor Day, called Beyond Willowbrook. And that was really exciting. We had a press conference, and we've been sharing the anti-stigma material widely, just continuing to bring attention, obviously, to the stigma issues, and also reminding the public, right, that this agency, this system, people with developmental disabilities exist and have a really important place in all of the work that we do as society. So we're proud of that, and proud of the communications team. And just to mention that anti-stigma campaign was born from a focus group, and the group members were comprised of people with developmental disabilities, their family members, providers. It was intentionally diverse, multicultural, and out of that group came the Look Beyond message that we've been disseminating. So we're really proud of that. Want to make sure people probably are aware, but want to make sure that people are aware that the next step in our activities related to the managed care assessment that we're conducting with Guidehouse will be happening over the course of the next couple of weeks. We'll be hosting, I think, 6 town halls, 2 town halls for providers specifically, and providers will have received their own invitation to that. And then 4 town halls geared towards people with developmental disabilities and their family members or their circles of support. These are meant to be dialogues with Guidehouse, our contractor, hosting this and hosting a dialogue designed to capture an understanding of people's thoughts on our current system as it exists, what works, what doesn't work, thoughts on managed care, what are the myths about managed care, what are people's fears, what do people know, all designed to help facilitate that conversation. And we've had a lot of questions about whether that will be a presentation or a dialogue, and it will be a dialogue. It's meant to be another opportunity for bi-directional engagement. It will start with a large sort of town hall presentation by Guidehouse that will be short. There'll be a large group discussion, and then we'll break into smaller groups so that there will be even more of an opportunity for smaller group discussion. Guidehouse will also be releasing a survey that will go wide, that will provide people an opportunity to participate if they can't be in person, or they're just people who don't like to participate in person or share their thoughts in public. The survey will also capture a lot of the same questions, so people have multiple opportunities to participate there. A few updates on our workforce projects, because they're so critical, and our workforce is the top of mind issue these days. I think folks know a lot of the money that we allocated through ARPA went directly to workforce. And several of the projects that we've been talking about for a long time are up and running and doing really, really well. So want to give an update on that. We've been partnering with SUNY to develop a micro-credential program across the state. And that consists of a partnership with a community college location, 1 or 2 providers in the region, and OPWDD to provide a micro-credentialing. It's happening at 13 different community college campuses across the state. We have multiple voluntary providers participating with us to have their staff go through those micro-credentialing. There's a stipend that goes along with that. And even some of the campuses have been enrolling students who are not currently working as a DSP, but have learned about the micro-credentialing and are interested in becoming a DSP and are using the micro-credential as a first step, which is a great, great thing. That's what we're hoping will happen. Most of the schools already have waiting lists. So we're very excited about this, and we really see it as a pipeline for bringing in new staff and also for, continuing to support our existing staff. We've been partnering with NADSP on that too. I shouldn't forget to say that. We also have been partnering with NADSP on a separate project, the eBadge Academy, and we've currently certified more than 700 staff of voluntary providers across the state, and we have more than half of the 2,400 seats that we allocated for this project are filled already, and that means that students are going through that credentialing process. I had the opportunity to go to the National Alliance for Direct Support Professionals conference a couple weeks ago in Pittsburgh with some members of the OPWDD team, and it was really incredible. And actually, New York is really doing really great work in this space, and a lot of the other states were really looking to our successes to have more conversations about that. So we're really excited about that and really proud of that. And the New York Alliance is providing technical assistance to service providers on recruitment and retention. We actually just had a webinar with the New York Alliance and Nick Silver and the providers who participated in that this morning. And the New York Alliance conducted an organizational self-assessment. It was voluntary for providers, and then also provided a survey to DSPs to understand some of the challenges that providers are having with recruitment and retention. And then from the DSP perspective itself, why are DSPs leaving the field? What would it take to keep them? So the analysis of that work was shared with the providers that took part. We had a webinar this morning, and technical assistance and training will be the result of that, and that will be ongoing over the course of the year. And there was pretty good participation in those 2 survey opportunities. So we're excited and proud of that. Also want to tell you quickly that we are awarding more than $13 million in grants to 8 nonprofit service providers across the state for the next 4 years to fund career-specific vocational training opportunities for people with developmental disabilities. So these grants will really fill in the gap between what our habilitative Medicaid programs, can or cannot provide. And we're very excited about this. We'll be represented in every region across the state, and 2 of the regions will have 2 providers funded in those regions. And it's an opportunity to help people with developmental disabilities develop marketable skills for employment, which is obviously a big focus. And on the same note, I just wanted to make a mention of the New York State Disability Rights and Employment Awareness Month symposium, the DREAM Symposium. This will be the 2nd year that it will be hosted here in Albany at the Empire State Plaza. It's hosted by the governor's office and Kim Hill, the Office of the Chief Disability Officer. OPWDD is a sponsor along with several other agencies. But it's a day-long symposium designed for people with any type of disability, employers who are looking to create inclusive workplaces, family members, anybody who's really interested in the topic is invited to attend the symposium. It was very successful last year. We're looking forward to a 2nd year. We'll be presenting on some of our activities there, and also really encouraging people that receive services from us or from our providers to attend and to get some more information, and really working hard on highlighting for businesses, right, the value of pursuing inclusivity in their employment strategies and the benefits from the multi-level, right, benefit of pursuing that. So that's some of the work that we are up to. I could say more, but I want to be conscious of the time and ask Allison and Jess to share a little bit on what we've been up to related to the strategic plan.
Good morning. This is Allison McCarthy. Before I turn it over to Jessica to share some feedback on the summer forums and upcoming activities, I just wanted to thank you for your participation and engagement over the summer months. Since that time, Jess's team has been reviewing and analyzing and really culling the information shared by many, many stakeholders, and it's obviously critical to our continuation of the strategic plan and our updates in the work we're doing moving forward. Since that time, we've also been able to have some conversations with all of you in the committee structure, which has been very helpful and, important. And the conversations have begun, and it feels great to be engaged and having OPWDD staff at that table. So we're just excited to be at this point, the work that we've done to be at this point and to continue that conversation. I'll turn it over to Jess to share some of the data. And I think the exciting news about the data is that we'll have baseline to compare year to year to really think about how are we developing, strengthening, growing, not only the information and the bidirectional communication, but also, who's at the table? Are we adding representation from our various communities across the state to ensure, all voices are being heard and considered? So with that, I'll turn it over to Jess.
Thank you, Commissioner. Thank you, Allison. And it's great to see all of you again here today. So I'll do a very quick try to be very quick with the presentation and overview of some of the happenings around the strategic plan. I'll start with just sharing the goals and objectives again, which I know you guys are familiar with, but just in case there's somebody who's not, I'll talk a little bit about what we did over the summer and some of the initial analysis of the feedback. So as I mentioned, most of you are aware, but we have three overarching goals for the strategic plan for 2023 to 2027. The first is focusing on strengthening our workforce, technology, and collaboration. The second is focus on transforming our system through innovation and change. And the third is focus on enhancing our person-centered supports and services. We identified in the strategic plan that we released last November objectives under each of those goals and some anticipated outcomes. For goal 1, we have objectives around the direct care workforce, data access and technology, and stakeholder engagement and collaboration. For goal 2, our focus is on supports and services, regulatory and policy changes, and research and innovation. And goal 3, children, youth, and young adults, complex needs, and cultural and ethnically diverse communities. So as all of you know, we're continuing our efforts to engage with stakeholders, and it's a key objective within our 2023 to 2027 strategic plan. As an agency, we really are committed to connecting more often with as many of you as possible, with as many different stakeholders as possible, and those who are, touched by, interacting with, impacted, or, providing services within our system. Through this work in our strategic plan, we're continuing to find new ways and opportunities to be innovative in how we're trying to do outreach and communicate, how we can connect with people, how we can make sure we're listening and hearing from diverse voices, and also thinking about how we can continue to do to improve and how we're sharing updates on the work that we're doing and how we're responding to the feedback that we are receiving. So this summer we held 10 forums specific to our strategic plan. We held 6 of those in person in Buffalo, Watertown, Utica, Westchester, Manhattan, and Long Island. I'll note that we do have a plan to rotate around the state for the next few years so that we can hear from different voices in different regions. We also held 2 forums online, and then we held 2 forums that were 2 very focused events. One with a community-based organization that primarily serves families and individuals from the Chinese American community, and another that was focused on those who might speak Spanish as their primary language or preferred language. Some of what we heard, actually I should say that we had over 900 people who participated in those forums, and we heard from over 170 people through those different opportunities. Some of what we heard from those folks who did share, was connected to what we're doing around language access and some of the work we're doing around diversity, and equity, and inclusion. Some concerns around self-direction. People shared about our recent modifications to our family support services, interest in increasing access to employment opportunities, how we're interested in learning how we're expanding our housing continuum, including transitional housing and other. Obviously, workforce, is a priority of ours and everybody else's, so we heard a lot about workforce. We had a lot of people who shared about transparency and data, and we're excited about the direction they see us moving in as an agency related to that scope specifically. Care management, access to services, and then there's, a number of other smaller subcategories that were shared as well. So we had the opportunity to share and hear updates through our forums. We also did distribute a stakeholder survey. We're happy to say that we received over 2,000 surveys back, some of which were partially filled out, but we're looking at ways to understand from those that were partially filled out how we might be able to improve our survey moving forward to make sure that we have more higher completion rates. And we're also looking at it to gather as much information as we can anyways from those partially completed surveys. Overwhelmingly, we heard a lot from family members and caregivers. Our next highest category of people that we heard from were providers or people who are representing provider organizations. And I'll note, I don't have a graphic here, but we did collect demographic information from those who are participating in the survey. And a majority, close to 75% of those who participated in the survey identify themselves as white or Caucasian. So it's another area of work that we continue to explore how we can expand and provide opportunities and think about how we're reaching different voices in different communities. I will say geographically, we had, pretty decent broad geographic reach from those who participated in the survey. So you can see some of those results on this slide here. So we're excited to see that diversity reflected. So I'm going to provide a little bit of what we heard through the survey specifically, some of which is in alignment with what we heard from the forums and at the forums, and also what we've heard, which I don't have reflected in the slides, from county representatives as part of our local planning, which John had mentioned earlier in the presentation as well, where we have a role and learn from counties. So we did ask people if they had a chance or opportunity to attend any of our strategic plan updates or discussions to have an understanding of what, who's participating in the survey, how much they might know, and also to understand where we might be able to improve our communication and engagement. A majority of people who filled out the survey noted that they did not attend any events specific to our strategic plan and some of the updates that we've provided. So I just want to flag that as we continue to look at the other information that I'm going to share that most people didn't participate in an update, to know about, a lot of the work that we've been doing. So we asked people how satisfied they are with our current 2023 to 2027 strategic plan goals and objectives. Part of this opportunity is to, touch base to make sure that we're still in line with what the community thinks we should be focused on. A majority of people said that they are satisfied or very satisfied with what we are focused on, or were neutral and didn't, have a strong feeling one way or another. And I'll note that in the presentation, when you see some text in the bubbles, that's qualitative data. So that's information and quotes that people shared with us specifically. So those are from people who participated in the survey. So some people noted that they think the goals are good and are helpful. And, they want to see us continue to work towards them. Some people noted that, we have a lot of work still to do, but they were positive about the direction that the agency is going in. We did ask specifically how satisfied people are with the progress that we have toward meeting our strategic plan goals and objectives. Again, we had, pretty good representation for those who are satisfied or unsatisfied. A majority of people noted neutral, so they didn't have strong feelings one way or the other. This is where I think, in addition to those who are participating in the survey, noting that a number of people might not actually be fully aware of what work we're doing because they haven't participated in an update. So that's something that we're exploring more as an agency to make sure that we're doing the appropriate outreach and communication so that hopefully over time we'll see in these numbers, obviously preferred higher satisfaction, but also preferred lower, neutral response necessarily as well. Some of the themes when we asked about priorities of people and what they think we should be focusing on, and of the feedback, again, were very similar to what we heard in the forums and what we've heard through other engagement opportunities that we have on a regular basis. Workforce was by far what we heard about most and what people prioritized. Then was housing, self-direction, employment, and a variety of other topics which are reflected on the slide. We don't have all of the updates here in this presentation, but I can say that in the upcoming annual report that we'll be releasing, you'll see more information on the work that we did, the feedback that we received in more detail, and then you'll also see a lot of different updates on the work that we're doing across all of our goals and objectives. So we'll be speaking directly to some of the feedback that people provided, including what we're doing around workforce, which the commissioner has, mentioned some of those efforts already here today. So you'll see more information around the workforce efforts that we have underway, what we're doing around housing to make sure that we're increasing access to a variety of different options, whether that's independent living or transitional options or others. You'll see information related to self-direction and the work that we're doing to modify and improve that model of delivery of services, including some updates on our evaluation. Hopefully you've had an opportunity to see that contract and that request for proposals that went out. It's on our website. So if you haven't had a chance to review that, it's already out. We're in the process of that and finding a contractor. So we'll have updates around that and other work we're doing actually around self-direction. And then a lot of different work that we're doing related to employment and meaningful day programs, which, as the commissioner noted, some of that will also be shared at the upcoming Dream Symposium. So a lot of information will be in the update, and we encourage you to take the opportunity to review that once it's out, and we can have further conversation at the next meeting if that makes sense or what is preferred. So I'll end there and pass it back to, I believe, Nick or somebody else.
Yeah, thank you. Great report. I see you have dental and health and complex needs. From our point of view, we get a lot of complaints lately or a lot of discussion about that lack of access, training issues for providers. I'm surprised that wasn't mentioned as like a really high priority of people. Was it? And what metrics are there being developed to measure that aspect of things?
Yeah, so it's reflected there. So it was mentioned. It wasn't like, if you look at all the other topic areas, it wasn't as high as many of the other topic areas. So and I just pulled it down, but the bubbles that I was showing, and we can share it, that was reflective of how often it was actually shared. So the smaller the bubble, the less people prioritize that specifically. But we do have, people have shared feedback similar to what you're saying, obviously, right? So we've heard that. And in the update, we're going to speak to a lot of work we're doing around health equity and access to a variety of different services, including health and dental services. So there'll be more there. So we're trying to engage in a lot of different ways to increase access, obviously, to those services.
If you're interested and if possible, when you do get into that, if we could bring that to our health subcommittee and have a discussion surrounding that, I think that would be very valuable to everybody.
Absolutely. And I should have noted, thank you for mentioning that obviously a lot of the work and what we're hearing through the forums, we're planning to, continue to have the conversations with the committees. Like we're sitting on all the committees and as an agency, have reps on all the committees for DDAC. And we see this as just sharing information as another opportunity to expand the conversations that we're having. So we're happy to bring back some of what we're hearing on any of the specific areas to any of the committees as makes sense and people might want, in addition to putting it obviously in the actual update, the formal update. So happy to do that.
Yeah, just one additional thing. We are working on trying to develop a metric with Department of Health on operating room access for dental care. And I would love to see that coordinated as much as possible with you guys. So
thank you. We appreciate that.
Thanks, Gary. Other discussion? some time here for discussion and reaction. Suzanne?
I'm curious about the access item that you shared with us. What does that include? Is it eligibility and determination? Is it access to a specific service? You know, how do you break that down?
Yeah, so in that slide, it was reflected for all of the above, but we are looking more deeply at what people are talking about. So if it's something specific to housing or self-direction or access to, you know, to eligibility or the front door, or how we can improve those resources. So it's kind of all of the above in that context. But then when we look at it, we kind of look at it a bit more closely, specific to the program or, you know, part of the process within which people are engaging.
So I'm very interested in complex behavior and the needs an individual has across multiple systems. So in terms of access to a higher level of care when somebody presents to an emergency department in IDD crisis to include mental health, you know, the gates aren't open. And we really need to hone in on that. And that is what the complex behavior work group is really going to be focusing on. So would love to have any data specifically that you might have. How many times does somebody sit in an ED for months at a time waiting for an appropriate discharge and a safe discharge?
Yeah, and I'll note, you know, just qualify that the information that I'm sharing is from feedback received specifically from people. So it's a little different than the data you're asking for, right? And we're happy to share more of that. And then we'll be working with DDAC as a whole to talk about how we share other types of data with committees in the ways that make sense, and, you know, familiarize you with what data we don't have access to, how we can best visualize it and share it. So that's ongoing conversation. Yeah, and specific to the complex behaviors and access to services in that sense, or like, you know, dual diagnosis or across systems, we're doing a lot of work in that space. So you'll see some of that in the update. And I'm assuming folks are talking about it in your committee, but we'll make sure, if not, that you guys have a more specific opportunity to learn about some of those
Committee
work
has
that we're
had
doing.
some starts and stops.
Gotcha.
And hopefully we'll get that ramped up pretty soon. Sorry. And, you know, but would appreciate any assistance. And we have worked with Jill
Perfect.
Pettinger in the past.
The right person.
Yeah.
So yeah, great.
Jessica, hi, it's Stuart in New York.
Hi, Stuart.
Hi, I have a question which may be for the commissioner who preceded your analysis here, but the open forums for the managed care evaluation. I understand that there will be 2 settings for providers, for the general public. I'm curious why we can't include self-direction as a individual set-aside meeting for managed care, because I think that's is as important as the provider perspective.
Yeah, I think it's a good question, and we have talked a little bit about sort of various configurations, and part of the reason is because we want to have multiple opportunities available, understanding that people's schedules and calendars don't always all align. And certainly I think when we're talking about, you know, the 20,000 or so folks who self-direct their services, we also have discussed, though, that, you know, within the larger forums, when we break out into breakout groups, perhaps grouping people who identify as self-advocates or people who identify as family members together, so that those comments can help breed, you know, discussion, right? We know that people will be reacting to what other people say, and it will help make those conversations more helpful. So we are asking, when people register, to identify whether they are a self-advocate, you know, a family member, a provider, multiple, so that we can consider how we might group those breakout sessions. I hope that's a helpful answer.
No, it's definitely helpful. And so are FIs considered to be providers and CCOs?
Yes. Yep. Yes.
Thank you.
Thanks, Stuart. Other comments, questions? Gary, to your point on the forums, and I know from my own participation in the forums, I do think that sometimes people come into the forums with a mindset of focusing on OPWDD services. They don't always think about the healthcare services. So I think that's a reason why maybe we don't get as many comments on healthcare. Because certainly all the providers that come are usually providers in the OPWDD system. So that might help explain why there was less commentary.
That doesn't mean it's not of critical
Oh,
importance to
no.
individuals, and that's
No.
where a survey may not reflect something that's really on the top of mind.
So maybe a more focused health survey.
Yeah.
Yeah, and also, and as you'll see in the update, like we look at what people are sharing to make sure we're on, the right page, right? Make sure we're being responsive to what people think. We're doing work in all of these areas, regardless of how big the bubbles were on that slide, right? So we understand the importance of the topic, as do others who may or may not have participated in any of these opportunities. And so we're still trying to address it. Yeah.
I just have one question. Have you given any thought to doing surveys in terms of wait lists for some of the clinics that exist? Because I was at a couple of recent provider association meetings and this topic came up with extremely long wait lists. And I think it would be valuable information for you to have to, inform some future decision making. I mean, I'm told that dental services are like 18 months. Psychiatric services like a year. And I'm curious if that's across the state or, more regionally located, but definitely access is a huge issue. I know that my staff are sending people from Rockland County into the Bronx for dental services, which is not ideal. So, and I do know that this problem exists across the state. So I think the data would be really helpful.
Thanks, Randy. Other comments? Buffalo, New York?
Hi, this is Missy Miller. I think that there's, a lot of the families that I'm speaking with, and even myself included, when you have a lack of support services, when you have medical complexity or multiple across the board conditions, the outreach that's done doesn't always land where we need it to land. If a family doesn't have the opportunity to be, checking an email or, so I'm not sure how better to get those kind of surveys completed and, because I do believe that there are many more medically complex or multiple, need families that are reporting. And I don't really know the answer. I wish I did, but I think that we need to think about maybe some kind of different outreach.
I would just say, I think it's a great comment. And it's something that we're consistently, right? I think every time, especially in the past couple of years, as we've been really trying to revive our outreach efforts and ensure that we're reaching, sort of far corners of where we're not traditionally getting to. We're constantly, trying to self-assess. How did we do this time? Did we get more participation? Who are we missing? We're working with, obviously, our, traditional email, social media blasts, listserv blasts, but also continuing to work more closely with CCOs and our providers, right, who are, on a regular basis, daily in touch with people and can help make sure, right? I mean, even if, I'm thinking like, if we're doing a life plan, right, maybe you just say at the end, right, I can pull the survey up for you. Can you take 5 minutes to complete this? I think it would be really important, right? I think there's a lot of different ways that we can continue to coordinate, and we're learning at every outreach opportunity how to do it better next time.
And this is Buffalo, and just an added comment on the medical field. I know we talked about dental a lot, which is of course critically important as well. From a medical standpoint, I don't think the families, like you already mentioned, think about medical when they're doing some of the stakeholder engagement. But the reality of it is emergency room access. There's no reason that people with IDD need to sit for 6, 12, 15 hours in a waiting room. They don't understand. So it's ER waiting, it's ER access as well. And also it's the training and education of the medical staff. Some hospitals can do it and some hospitals don't do it very well. And so there needs to be some type of initiative developed to train and educate all the levels of hospital staffs on how to effectively, with respect, work with individuals with disabilities as well as their family members.
I've actually met with, it's Missy Miller again, I've actually met with the CMO of one of our local hospitals because I had experienced an issue and I had heard from so many, a few other people, and that was what was identified as the problem. His answer was, well, our staff just isn't really trained in this. And so I asked them, it's a big hospital system, and I asked them to, well, why don't you take on educating them? Like, work with us and see if we can somehow educate the doctors, because it's a population that is growing and, they have medical issues also. He agreed, but nothing has been done, obviously.
This is Susan in Buffalo. I think at least some folks are aware that Section 504 is being revised to include and make sure that medical issues are being addressed and that education in medical schools include working with people with disabilities. So I would be interested to know, once those regulations come out, how OPW is going to be working with Department of Health to realize those changes.
Thanks, Susan. Stephanie, you have your hand up?
Yes, I was in the hospital about last month, and I sat in the waiting room for 12 hours. I ended up sitting there, and they said they had no rooms or nothing. And a lot of places don't take straight Medicaid, because I'm finding more and more of that out.
Yes.
They
Thanks,
told-
Stephanie.
They told me I needed a second insurance to go with it.
And I think we see that in some of the certified residences, we've been very successful with using telehealth. But with so many of the folks we support living in the community, they don't have access to the same level of telehealth. And then that results in more ER visits. And thanks, Stephanie.
I don't want to belabor, because I know that the agenda, we're probably off time. But I do want to just say that we have sort of like very early initiative and effort working with the Department of Health on health equity and health access. And the Department of Health has been, very interested and eager partner in thinking about some of this. And it's still very much under development, so not able to say too much, but definitely includes things like thinking about education and training and using the Department of Health's existing grand rounds work that they do with medical schools to bring some of this to the forefront. Because we do hear, I think, a lot that it's not for lack of interest, but for lack of ability that services, that are not available, which I don't necessarily think is the right excuse, right? But will get there.
Gary, one last comment.
One
I'm
last
gonna move
comment.
on to committee
And I
reports.
think the commissioner at the commissioner level is very helpful in this, and thank you for the efforts related to dental, because I think that helped, in my view, push some of the funding into the operating room issues to the finish line. So thank you.
Thanks, Gary. Okay, now we're going to move on to the next agenda item, which is committee reports. And I'm going to turn it over to our vice chair, John. John?
Thanks, Nick. I mentioned earlier on about the committees, and we're going to run through some of the committees that have reports to make to the council. I'm going to actually take the role of to report on the residential committee. Our colleague Paul Jocelyn is unable to be here today, but we do have, if you can go to the second slide. Okay, okay, go back to the first one and we'll just touch on that. So we, at the last council meeting, resolved that we would create a children's committee. And we came to that after consideration of whether or not it would make sense to include a thread of children's issues in all of the committees, so that, you know, how children's health, how data is collected around children's needs, etc., or whether it would make more sense to create a standalone committee. And we resolved that it made more sense to create a standalone committee. And we're very lucky that Randy and Jeff have agreed to co-chair it. And they are now going to be reaching out for members from the council, but also from other folks who are interested in helping. So that's a step forward. Next slide, please. So the members of the residential committee, there are about 18 of us, representing all parts of the state, representing a lot of different roles. About a third are parents or people with developmental disabilities or advocates for them, siblings, and a considerable number are professionals who are engaged in housing issues. Next slide, please. So our key discussion areas, and this will be an approach that we're going to take with all of the committees. The first being, we had a presentation back during July from our colleagues at OPWDD on where the process of heightened scrutiny currently lands. For those of you not familiar with the term, the Centers for Medicare and Medicaid Services, the federal regulator of Medicaid, requires that if a setting, whether it be a day setting or a residential setting, have an institutional character, that it be subject to heightened scrutiny to ensure that it doesn't become institutional in nature. So we were fortunate to have that presentation. It's something that we will continue to keep an eye on, because it's important that, you know, that there is a constant tug, if you like, towards institutional mindsets, and we have to be guarding against that. We created a subcommittee, I'm going to say about 4 months ago, to specifically focus on issues relating to certified residential settings, in particular because of issues that arose during the pandemic and the different regulatory environment that certified settings live in, and the different requirements in terms of direct support professionals, management, and budgeting. So that subcommittee reports back to the full committee, and they're just really getting underway with that work. I believe that they have a series of roundtables upcoming. We've seen some families, some people with developmental disabilities who have been denied housing subsidies on the basis that, to quote the response, they're not ready for more independent living, which is a bit of a thorny question because nobody's ever ready. Being ready doesn't mean that you know how to make your bed. It doesn't mean that you're going to be able to cook a meal independently or live alone. It means that if you have sufficient supports, you can live in somewhere of your own choice. And so we really want to keep on top of that to make sure that where those denials are happening, that there's a sound basis in policy and practice for those denials to be in place, and that there's a mechanism for folks to appeal that. Enabling technology in residential settings. So this doesn't refer to just major medical equipment, but more to the kind of generic technology that we all use. The good news being that in the most recent waiver iteration, we're seeing an assistive technology, or OPWDD is applying to increase the availability of assistive technology, not just for sort of major hardware, but also to help people who need subscription services for, as Nick was saying about telehealth, to enable people to be able to communicate more effectively and to reduce overall costs so that people aren't having to travel to clinics if they have a minor issue, but they can connect with the resources they need. At the last full council meeting, we talked about and resolved that we would work with OPWDD to create a housing policy for the future. We really haven't had a housing policy since deinstitutionalization back in the 70s, and we have a 50-year-old system, and we have to rethink how we do this. Our current system's kind of clunky, expensive, underserving, and overregulated. So we're looking to see how can we be thinking forward as if we had a blank sheet of paper, which is obviously a wonderful theoretical exercise, but the goal is to get something practical and have a policy that is transparent and understood by all of the stakeholders. We've recently seen where, due to staff shortages, people have been compelled to leave their certified setting and either go home to their parents or their family, or sent to a different setting that they may be unfamiliar with, either temporarily or permanently. And this is something we're very concerned with, because these are people, not units of billing. And we want to make sure that there's focus on this, as there is, that focus is coming from the broader public as well. And the 507 public forum feedback. So you heard from Jessica this morning, and I'm sure we're going to hear more when the annual report comes out. In terms of the key concerns of those I've just discussed, I think the group home closures and staffing issues are paramount. How can we make sure that people retain their home? And also the denials of housing subsidies on the basis of not only people not being ready, but we've also seen where folks are running into trouble with the terms of the ADM governing the housing subsidy, and their housing is being jeopardized. So lots of things to worry about and to think about, but I must say that we really appreciate the support and help from all of the members of the committee and our collaboration with the folks at OPWDD. I think we move now to Gary.
Thank you. And I'm glad to see we had some focus this morning on healthcare, and I thank everybody for their input. The DDAC Healthcare Committee has completed the transition of the medical and dental task forces to Jill Pettinger and her team. If you recall, it was decided that our role was to be more of an advisory group. Some of the medical and dental task force are working on some projects, and as a structural change, that was something we thought that would be more appropriate, working directly with OPWDD and Jill. But they're going to continue to advise us of any recommendations they feel are necessary to bring to this committee, as well as we'll provide updates on the work of those committees. So our structure is to have the chairs of the dental and medical task forces inform the Health and Wellness Committee of their work at each meeting. At the current time, we do not have a separate subcommittee of health and wellness for dental and medical. And that's because we've got those task forces working, and we would be a little bit redundant. But in our complex behavioral group, and tell me if I get this right, okay? If I'm off, let me know, because we've gone back and forth on some of the wording here. Our complex behavioral group has decided to work as a subcommittee of the Health and Wellness Committee, not to have that as a separate task force. Susan Levine is chairing that subcommittee. But of note, there is a separate group, a multi-system task force being formed outside of the DDAC to try to promote interagency cooperation to deal with complex behavioral issues. Dolores, did I get it right?
Suzanne is the chair.
Okay. We hope to hear reports on the progress of that effort. DDAC Healthcare Committee continues to meet and seek input from around the state on the status of healthcare in various regions. Our last meeting on September 12th featured Mike Alvaro and Deborah Williams from the UCP speaking on the status of healthcare as they see it for the New York State IDD population. One of the things that keeps coming up are the proposed changes in reimbursement models, managed care, et cetera. to be explored for the impact on improving services. And we hope to have some input in that because I think that talking to the providers and understanding where we might be going with that is important. And that may be a key to access the financial incentives and the system problems, which are very important to deal with. On a side note, we have been serving as a conduit, spreading the word about educational programs involving health and wellness. There's ongoing dental lecture series sponsored by Thoreau Dental School and the task force, as well as many other programs. And I hope you don't mind that I keep sending out blurbs to everybody about various educational programs and other events happening. And I hope as many members can go to these where possible. If there's a fee that you see and you're coming there as a DDAC member, maybe they are willing to waive it to have you sit in and hear what they might be talking about. But call me if you have any questions about any of these programs. And we're pushing education, we're pushing in as many levers as we can. And as I mentioned before, trying to get a sense of the operating room situation in New York, in various regions in particular, where especially the dental care, people have to travel a significant distance. And funding, there is some funding available. We don't know how effective that will be. We're trying to work with DOH on that. And UCP has also offered to help us with some of the surveys. So thank you.
Dolores.
I think Suzanne and I might want to clarify the complex behavior group.
Sure.
So under health and wellness, there will be a subcommittee of complex behavior. And that is to the point that I made earlier about individuals, being in an ED, waiting for a long period of time, needing a higher level of care, needing supports in the community when they're discharged. So that will be very focused in that regard. The task force, just like medical and dental, will operate separately from the DDAC, but certainly we will be reporting work and outcomes of that group to the DDAC because there will be a number of recommendations that will come out of it that the DDAC would likely want to hear about and certainly support. And so with that, the subcommittee, we will be working with Jill Pettinger and also likely, having the conversation about that task force with her as well. So we look to have multi-system partners on the task force. And I know that there are other groups who are certainly addressing some of the issues. I know Haney's is really working directly on that and would certainly welcome them to join us. So that's an example of membership. The BHAC, the Behavioral Health Services Advisory Council, we would look for membership from. So certainly starting to develop that. And I believe we will be meeting with Jill, I think in the next few weeks to have that conversation in terms of next steps. But in terms of the subcommittee, we welcome any DDAC member to join us because certainly I know the work that we will do will really address some of the identified areas that many of our individuals are struggling with and hope to partner with OPWDD on that resolution along with our multi-system partners.
So the subcommittee is focused on OPWDD issues, but we know that the issue of complex behavior is bigger than that. And so that's why we have recommended a multi-system task force that we hope to co-chair with members of the Behavioral Health Advisory Council, as Suzanne said, and bring other partners on.
And let us know if you need, and not introductions, but just, if you need us to help dialogue with some of those other services, we can be helpful there.
That'd be very helpful. Thank you, Commissioner.
And thank you both for your advocacy in that area because we know it's important. Gary, did you have anything else? Hey, John, can I just pause for a minute? I know Randy D'Antonio had some issues signing on. Randy, are you on now?
I am.
Very good. All
Do
right.
it.
Thank you.
Yeah, it was a little bit of a struggle, but thank you to whoever helped me. I think it was Josie.
Yeah, Josie's out today. It was Rachel, but thanks,
Oh,
Rachel.
okay, thank you.
Okay, all right. Okay, John, sorry.
So I think after health and wellness, Stuart's here and going to talk about self-direction.
Thank you, John. I'm just looking at our committee membership, and I recall after the last meeting, it was pointed out to me that I left a couple of people off. So I would like to just mention their names since they're not on this list. But Gail Pado from Racker is a subject expert on our committee. And we also have Alexa Donnelly from PCCS on Staten Island are on the committee. And so the next slide, please. Before I talk about the key discussion areas, I just want to mention that the OCS, Jessica and Allison, as well as other members of the OPW staff have been participating in all of our early morning meetings for the self-direction committee, even on short notice, and they haven't missed one. And I really want you to know how much we appreciate being able to collaborate with you. You've been very, very helpful in helping us to think through some discussions, as well as to show us leadership from your side. And I just wanted to recognize that. I'm looking at our key discussion areas, and I want to mention that two of our subcommittees have already met twice since the last June 20th open meeting that we had in June with OPW, and we are busy at work. One of the subcommittees is on sustainability and equal access, and we have quite a few of our members on the subcommittee, and we also have the sustainability and and the self-advocate survey we've been working on as well. Both are moving forward, and we hope to be able to give you more information at the next meeting. Some of our key concerns, I brought this up earlier, is the managed care open forums that are coming, and I thank the commissioner for answering my question. But I think we would love to know if OPW has a position regarding managed care. We think that would be helpful in our discussions internally on our committee when we look to think about some of our subjects that we want to move forward on. The other area that I wanted to ask you about is the RFP. We're not aware that it has been awarded yet. And I looked at the RFP, and I noticed that it says that the dates that were originally proposed for it to be made known to all is tentative and subject to the change at OPW sole discretion. So we would like to know what that means and where we are in that RFP. And the last point that I'd like to bring up is we are strongly concerned that the self-direction rules and regulations and policies are all over the place and not consistent from region to region. And we would like for OPW to really think about how we can create one system for all. Thank you.
Thank you, Stuart. Moving on to the next slide. I believe Susan's is on the call. I'm not sure if there's any report back from the Employment and Meaningful Activities Committee. And we're going to the Systems Quality Data and Service Delivery Committee. So I know Dolores is with us. So Dolores, I'm passing over to you.
Dawn, this is Susan. The Employment and Meaningful Activities Committee is meeting this afternoon, so we don't have an update for today.
Thanks very much, Susan. So over to Dolores.
Thank you, John. So the Systems Committee has not met for an entire year until this week. So we didn't meet because the committees were going to be aligned with the 507. And honestly, we weren't sure if there was still going to be a Systems Committee. So we sort of paused for a while. So now we're sort of rebranded at this point in time. We've always focused on quality, quality of life, and quality of the experience people have with the services, with central office, with the DDROs, with the providers, the CCOs, et cetera. So those are the two components that we've been looking at in terms of quality for a couple of years now. And we recognize also that workforce is an important part of the quality of services. So we're rebooting and we're restructuring. So we want to work with OPWDD to define our priorities together. Really, we've had some really good meetings with Jessica and Allison and also the OPWDD liaisons. So I'm very excited at this new path that we're taking together. And I think the committee members are excited as well. So we're also looking to embed the data community of practice that was referenced in the 507. That'll be embedded into the Systems Committee. So we're broadening our horizons, so to speak. We're going to address issues related to managed care as they come up, as needed. And we want to identify some non-committee members to join some subgroups that we're going to create. So we're probably going to have a data community of practice group, obviously. We might have a couple of different work groups on quality. So we're inviting members of DDAC to join us, but also other experts in the field on these topics. So if you have ideas, please let me know as we move forward. And that's sort of where we are in terms of next steps, just restructuring and getting back together. Next slide, please. Okay, so I've talked about that. Is there a third slide? Okay, so we still need to get some responses from OPWDD on earlier work that we've done around the front door so that we know how to move forward. We also had made some recommendations around care management, managed care several years ago, which we'll incorporate into our future work. So, and we also had made some recommendations around the events of 2020, not only COVID, but civil social unrest. And I think that even though we're past those times, some of our recommendations are still very worthy of consideration and discussion. So we'd like to get responses and have a dialogue on some of those issues in order to move forward.
Can I ask a quick question?
Yes.
Yeah.
You're right here, so.
We've got time for discussion. So we.
Well, I'm just curious, this is very interesting.
Can somebody repeat the question? We're not hearing it over here.
Okay, yeah, so I'm just interested when you talk about, quality data and you're looking specifically quality of life, quality of experiences. So at New Hope Community, we're working very much on really all of the departments wrapping around key performance indicators and really looking at exactly what matters specific to whether it be training, HR, QI, marketing and communications, IT, and residential, and on it goes, really understanding what is going to be specific drivers of particular outcomes that we've identified as this is our goal. And it just doesn't seem to be something that a lot of people in our sector are really embedded in, comfortable with, knowledgeable, experienced in. This has been like a one-year process for us so far. So my question is, and like in HR, when we talk about workforce being so important and understanding recruitment stuff and retention and all these things that tell us something, how are we doing? What could we change? So any chance those sorts of things, because it kind of broadens the net in terms of what you're capturing specific to your metrics, and also in terms of staff performance, you know, et cetera, et cetera. Is that going to be possibly folded into that where we could broaden?
We're open to discussion.
Okay, excellent. Because I think that really needed.
Yes, you can join the.
Samantha.
Hi, Dolores. Thank you for that. So I generally work with data all the time. My job is that, so I would be willing. I would be very grateful if you can take me into that data service committee. I really need to know what you rightly said.
She's getting recruits this week.
Okay, thank you for that. I mean, we have been talking about it for the last couple of years now to get into data, and so I'm perfectly fine to work with. Thank you.
Good. And we have some time for open discussion now. So again, any other comments, thoughts?
Can I say one other thing that I promise? But in terms of talking about things we're doing with DOH, and you talk about grand rounds and really educating medical students, you know, I started out years ago as a pediatric RN, still have my license. This is a big deal to me and I think to all of us in terms of, I know nursing programs are not even close to where they need to be in terms of educating nursing students. So I'm very concerned. I went to Pace University at one point and spoke to the dean there of their nursing program. And what can we do in terms of, you know, give them clinical experiences at our provider agencies with the people that we so wonderfully support. And believe it or not, as we talked about prioritizing this education with nursing students, she said, you know what, Debbie, here's the problem. It really matters how our students perform on the boards. And when they test to it, we'll be more inclined to teach to it. And it seemed as if, honestly, the priority simply wasn't there. So medical students, hugely important. I mean, the entire multidisciplinary team, but nursing students are a big grab that I think we really need to figure out how to collaborate to improve that.
Just a quick comment on that, if I can. I actually attended last week the nursing meeting that took place over at the Marriott last week because there was a presentation on a dental toothbrush that's being used to monitor efficiency of use. And it was, everyone was coming to me about, or talking about need for training in the field. So I think you're absolutely correct. And years ago, there was actually an ongoing lecture series by a group of volunteer physicians on various topics that was attended by OPWDD nurses and done through a local group here called the Maimonides Society of Volunteer Physicians, resurrecting that, something like that. I think you would get nice attendance. And
Absolutely.
We have a group of nurses, I think I told you, Debbie, that rotate through Joanio.
Yeah, we do too.
Yeah.
From the local college. That's a big that I think all of us should have the responsibility of position to collaborate like that. Programs.
We're not hearing anything in Buffalo right now.
We were just talking about the importance if we're in a position as a provider agency to collaborate with local nursing programs so that we can create clinical rotations for their nursing students as they move through their program. The unbelievable value of that. Sometimes it's amazing. You're opening their eyes to something that they have no context of or in. So yeah, that's important.
Yeah, I agree. And also, I would suggest that as we pursue our journey of increasing training and knowledge, that family members can also be great teachers. So it's just the level of respect that individuals with disabilities and the family members should have in a hospital setting or in a physician's office that all of us take for granted if we're of average intelligence or ability, but it is not provided on a consistent basis to people with IDD or their families. So family members could be great teachers as well. And of course, there's many family members out there that would volunteer to do that because it's just a different vantage point than a professional education. Go ahead, Susan.
At
This is Missy
the
Miller.
University of Rochester Medical Center, there is a family experience for all pediatric residents, and it is a class that they must take.
Hi, when I was years ago, when my late daughter was still alive, I learned about a program that was actually several moms that got together. They each had, child with medical complexity, chronic issues, and they met with similar to what I did. They met with the CMO of a hospital, saying that they felt that the pediatric staff did not know how to deal with their children when hospitalized or out in the community. And they put together a program called Project DOC, and that stood for Delivery of Chronic Care at that time. But because the hospital didn't, although they agreed, didn't really know of a way to educate the physicians and the nurses, so they offered these moms the opportunity to put together an educational program, and they welcomed it into their pediatric residency rotation. And it was a mandated part of the rotation, similar to what you were saying. As they went through their pediatric years, each year they had to go either to the home of a chronically ill child, and that parent would teach them about what's involved in just the day-to-day care of a child like this. Then they had an interview with a parent or a grandparent or a father, to find out, all of the other different set of needs that this population has. And so I think, as is a lot of the time, the parents came up with a solution, and the parents were the best teachers. There were absolutely no physicians, nurses, anything. They were all family teachers for this program. And it was so wonderfully received that it went nationwide. There were articles about it. And it was strictly like there was maybe a small stipend for years, but it was mostly volunteer. I myself volunteered for over 25 years doing the parent teaching part of that. So I think, the frustration that I had when I met with the CMO of this hospital system, the answer to educate physicians, to educate nurses involves the education department. It involves, there's so many facets to how do we get that, that training in. And that's going to require legislation and all the other fun stuff. In the interim, maybe this is some kind of philosophy we can get going if there are, family trainers or families willing to help with that. Just a thought.
Missy, I know in Syracuse, Lemoyne College had a similar kind of program where they actually invited families to come in and present to their nursing cohorts to raise awareness of some of the challenges and in the issues. And that was very, very well received by the nurses. Some of them.
I can't tell you how many people had said.
Talk to the family member of the individual.
So many of the residents were like, we would never know this. How would we know this? How would we, you don't know what you don't know, like Pocahontas. That was one of our big lines was, when you walk the footsteps of a stranger, you learn things you never knew. And that's exactly the lives that, these populations live, and the doctors don't know. It's scary.
Jeff?
Hi, everybody. It's Jeff Fox. I just joined this committee and attended my first meeting with Dolores and others this week. And I just want to bring the conversation back to quality and data for a second. Quality of life is something that I've spent a lot of time in my career trying to define and measure, and it's an incredibly difficult thing to do. It can be very nebulous and it's hard to do with hard data. A lot of provider agencies are CQL accredited, so you can just ask people, talk to people, how's your life going, and what's important to you. But most organizations, provider organizations like ours, don't have the resources to do more than a very small percentage of the population that you're serving. So I think it would be great if, as a system, we could get to a point where we have a consensus about how to define quality of life and measure it in a relatively quick way.
Thanks, Jeff. Other comments, discussion? I know we have, as we went down the list of committees, Noack, you're on from Family Support Services. Do you want to provide us with an update? I know you have a meeting on Friday.
Tomorrow's our quarterly meeting, and we will be reporting on a number of items, including the RFP, which is the money that is allocated to the different regions for family support services. And we're just in the beginning stages of the process itself. We've collected our conflict of interest forms from our members, but we still have a way to go in determining priorities and also on learning the process, because the actual process may have changed from years ago. It used to be all paper, all families. I've been hearing that some different local councils who have had an RFP on their own, because they had their own little money and they had an RFP, that they were using a computer system. So that is one thing we're working on. We're also going to have a report on a little bit about family reimbursement. I should step back a little bit. We've formed 4 subcommittees, and the RFP is one, family reimbursement is another, and we also have advocacy and stakeholder engagement. Each one will report on what they've been working on since June. We've really just formed those subcommittees in June. So aside from that, I think that's all I have to report right now.
Good, thank you.
You're
We
welcome.
still have some time for open council discussion before we move to public comment. Dolores. Thank you, Dolores. Yes, yeah, actually that I should have touched on earlier. As you know, last year we did a very quick change of our bylaws to incorporate the language to acknowledge the now authority of the legislature to appoint members, but we didn't change the bylaws or update them beyond that. And so the executive committee will be working on some thoughts that were captured over the past year. Dolores has been, keeping a great list that we want to be able to use to update our current bylaws. We need to make sure once the EC does finalize those changes, we'll send the council a draft and then a final, and that's got to be done 30 days before our next meeting or before we actually approve those bylaws. So I talked to Mary Beth Babcock yesterday about that, and she's given some input, and we'll certainly make sure that she's involved in seeing those before we submit them. Did I miss anything, Dolores, on that?
Just that we'll have companion guidelines.
Right.
Members.
Right. Thank you. Other discussion items?
Earlier, Stuart.
Nick, may I also add, this is Kathy Nowak. We also approved our bylaws between, well, they are approved as of the June meeting. And I have to just compliment Mary Beth and all of the OPW leadership. It really went well, how we were able to figure things out, because in the beginning there were a lot of concerns and questions that the committee members had. And I have to say, it was like a big deal for us that we got our bylaws passed. So I want to thank them because they were very helpful.
Very good, Kathy. Thank you for letting us know that. Deb?
I was just going to ask, because it looked like the commissioner, maybe I'm wrong, but Stuart was asking about an RFP specific to self-direction. It looked like you were all poised and ready, and then we moved on, but I was interested actually in what you might be sharing about that.
Oh, sorry, not to be anticlimactic, but just that we're still reviewing the responses and don't have an awardee yet. So that's the answer.
Okay,
Oh,
very good.
Sorry.
Other items for discussion? And I would just remind people to take themselves off mute if they do have anything. Some good time. So I think we're now ready to open it up for public comment. I'll pull the three sites. We'll start here in Albany. Do we have anybody signed up? Hi. Could I ask you to identify yourself? And very good. Welcome.
Sorry. Hi, my name is Darlene McGraw. I live in Saratoga County here in New York. I'm not going to read you a whole booklet, but I wanted to read that the mental hygiene law section 1.3 defines a developmental disability as developmental disability means a disability of a person which one is attributed to intellectual disability, cerebral palsy, epilepsy, neurological impairment, familial dysautonomia, Prader-Willi syndrome, or autism. And then read the rest because everybody else will think it's boring. I got this card from OPWDD to give to my providers and give to the office staff. It basically lets them know that I have autism and epilepsy and other disabilities, and sometimes I have a hard time. And especially the secretaries. I mean, you could be the best darn doctor, but have the worst secretaries in the world. And screw you, I don't want to go to your darn doctor's office because you stink. So basically, I think the secretaries need to be, thoughtful too and treated, learn some of this stuff too. But yesterday I had a little bit of a quote unquote episode in the doctor's office. I almost pulled out an IV and almost would have been going all at it, I guess, put it bluntly. But I had my aide that was downstairs. He had to be waiting downstairs because they wouldn't let him in my appointment with me when I was at the cardiologist. That being said, those of us with such developmental disabilities such as epilepsy and autism, we have many multiple chronic conditions, and we need different supports in the community to help us with transportation, accessible, affordable, and safe housing, close to our doctors, support persons, and places of employment, as well as access to higher education. I'm not able to go to higher education due to the lack of public transportation to get to school. I can't drive due to my epilepsy. Access VR won't allow me to go to college because there's no public transportation to get to and from my school that I want to be able to go to because it's the closest one to my school. I'm not able to get OPWDD because I keep getting denied. I was misdiagnosed when I was a kid. I was born in the 80s, to give you a gist of how old I am. I had a problem when I was at the emergency room. I walked at least 11 miles from the emergency room back home after having a seizure. I almost hitchhiked, but I decided it was safer just to keep walking despite having a seizure because I didn't want to wait over 12 hours. I waited 11 and a half hours and I didn't want to keep waiting. So I walked 11 miles from one county to a whole nother county. That is not safe. I don't know how many other people have done that, but I did, and there's probably other people that probably would. I have not been able to get access to dental care for years because no dentist wants to work on my mouth because I have seizures. They're afraid that I might have a seizure in a dental chair and I might bite them or something. That is not access to health care. I asked about going to see a mental health provider in Saratoga County. They told me the wait list is at least a year, possibly longer. I would have to be seen in an emergency room based upon an emergency visit, and that might take at least 6 months. So there's just the gist of some of the things that I've been going through, and I'm sure other people are dealing with similar situations. We got to stop this. Thank you. Thanks for your time.
Nick, I know what she's talking about because I was in the hospital like a couple weeks ago, and I told the doctor for 2 months that my stomach was bothering me. They said that thank God I got to the hospital when I did because I would have died. They said that I had an infection in my stomach and in my bowels, and it spread to my intestines, and it was going to my upper chest. And there's a young man that walks from the baseball field in Buffalo because his paratransit, his home makes it too late for him. And then he has to walk all the way from the Bison's field all the way to West Seneca. And I won't let him walk. So I have my mom or dad give him a ride home instead of walking home.
My name is Meir Buchinger. I'm not a speaker. I'm not used to speak for DDAC or 150 people. Last time, Josie told me that it's on the meeting was 150 people, but I'm not used to it, so I will try my best. So, at the Developmental Disability Advisory Council meeting, I have the honor to present a letter that I have created with my group of advocates. This letter contains 16 proposed changes to the self-direction process to the Commissioner of OPWDD and the DDAC. It is a privilege to be a part of such an important moment. As a resident of New York State, I'm proud of the work that has been done to improve the lives of those with developmental disabilities. I'm confident that the changes I have proposed will make a positive difference on the lives that those affected. Thank you for allowing me to share the changes and considering for them for implementation. I look forward to continuing work with the Council and the Commissioner to ensure that changes are put into effect. Again, I'm grateful to the opportunity to present this letter, and I'm confident that the changes I have proposed will make a positive difference in the lives those affected. So let me introduce myself. I'm a support broker for the people with developmental disabilities, and we saw that there's a lot of difficulties people having utilizing these services. There's a lot of opportunity in the self-direction program, but utilizing it is very hard for them. So we sit down with the care manager, brokers, parents, FIs, and we came up with 16 changes. We tried it should be the most possible. It should be implemented, and it shouldn't be other people. All the people should like it. I hope we will accomplishing with that. And thank you for your time.
other members of the public here in Albany. I believe we have one.
Nick, it's Stuart in New York. Could we ask the man who just spoke? We haven't seen, on the self-direction committee, I'm the chair, but I haven't seen this, these 16 proposals. Can it be sent to Josie and then sent to the committee?
Yes, Stuart, we can do that.
Thank you.
We have one member of the public here. If you have anything you want to say, that's fine. If not, that's okay too.
Oh, one of the issues that I'm having is constantly proving my son's disability. My son is 10-year-old. He's autistic. He's a very well-behaved boy, but at times he have unexpected issues or things going on. My problem is I deal with the Department of Transportation. When the time comes to be certified, I feel like a hit in the face for them to tell me, oh, your son doesn't have autism disability. And this is something that I deal with every day. I take him to behavioral doctors, his pediatrician doctors. He goes to YAI and self-direction, all the support team in the world to support him. And every year it's a fight just to prove his condition. And I don't know what the correlation could be between the Office of Department of Transportation and OPWDD, because I do submit the information, but it's just heartbreaking to constantly tell that your child doesn't have a disability when you see all the physical and all the documents dated. So I'm hoping that they find a better way to help us families or people that have this plaque, help us, make it a little much easier besides the heartbreaking of telling you what your child does not have. It's a constant reminder of what he does have, but I try to be the parent to be stronger. So just looking for some help in that area with helping them to understand his mental and his, physical disabilities.
Thank you.
That's well said. That's great.
One other thing for self-direction. I love the program. And I do a lot of networking for people. I wish that things could be a little broader, because if you don't get to network with people who don't really know what's out there, and I know there's so many programs, and I wish they had something where, like, it could be like on a poster board or something, letting families know, hey, there's programs that recreational for your child, and this program or this company. And it seemed like some of them that I ran into is like, they are like kind of scared to take self-direction. I don't know if it's their marketing, whatever, but maybe we can help them understand, that it's not difficult dealing with self-direction, because we may not, as far as if I find a program and like, hi, my name is such and such, I was interested in my son attending this program, do you accept direction? Oh, no, you would have to pay up front. And everybody's financial situation is different. We may not always have the money to pay up front and be reimbursed later due to whatever our finances is. And it kind of shuts the door for your child to get in because we can't afford that, and I think, maybe we could try to work with the vendors to be a little more open and broad, so accepting our children into these programs so that they can benefit as well too. Because self-direction is a wonderful program. It definitely helps us families out. It helps me out tremendously. But when I get that door kind of shut in my face because I can't get my son into these programs, it's like, it's disappointing and it's a setback. But I'm hoping maybe we could try to work out a relationship or communication to let them know, to understand our situations and stuff. It definitely would benefit children, adults, and other programs that, people with disability needs, So that's what I would like to work on.
Well, you got the man right here.
He is the man.
No, it's a great point. I mean, it is an access issue. It's an access issue for all, right?
Yeah.
And, you're absolutely right.
Yeah, we want to work hand in hand so that it won't be difficult for people with disabilities feeling unwanted and things like that. They want to feel, the most they want to feel is fit in the community as well too. They're aware of their disabilities, for most, and it's nothing like being able to be in the same environment. So I'm hoping that we can work together as families and vendors and put it out there so that it could be much easier and have a smoother process. Yeah.
Thank you very much.
John, do we have any other members of the public?
Thanks everybody for your participation. And I think especially just thanks for the participation in between the meetings, because that's when the real work is happening, and we're really grateful for it and for the collaboration.
Again, thank all of you who participated in.
On the virtual speak.
I'm seeing in the chat that there are some members of the public who'd like to speak who are not in the major sites.
Nick, I can run that.
Can you do that?
I can run that, yeah. So if you'd like to speak and you're participating virtually, just raise your hand at the bottom of the button. There's a little hand symbol and that will raise your hand. I'll call on you in the order that you raise your hand. When I say your name, you'll also be asked to unmute. So we're going to start with Edward Eisman. You should be able to unmute.
Thank you. Good
We can hear
afternoon.
you, yep.
Okay. Good afternoon, Commissioner and committee. Thank you all for opening the discussions to the public. I'm a parent and a guardian of a lovely young lady with Down syndrome, Linda Eisman. She is talented, caring, happy, and a good friend to many. And that's why I'm here. Okay, 2 comments from the previous committee's discussions. Okay, first, follow up on Missy Miller about the quality of medical care and also the other fields that support our loved ones. We talked about training, about sensitivity. The Department of Education requires 12 credits for all teachers to share teachers in the special ed specialty. All the teachers are required to have it. I know because my wife had taught that class for 20 years, and it was very successful. She was a Teacher of the Year award winner in New York in special ed. The UFT has been teaching these for so many years. These classes provide a sensitivity expresses a sensitivity to the teachers in the class. They were taught about families, about family connections, strategies, how to deal and how to welcome people with special needs. And it was very, very important for these teachers who had no idea of this population. And they're the ones who are spending 8 hours a day. This kind of required training may be something that we should be considering for the medical teams, for nurses, even for our own in-house people, listening to professionals who've done this before. Okay, second item is the quality of life. Quality of life comes up a lot in our family. It means different things to different people. And some people don't even know how it will improve their life. And we've always felt this ourselves. Okay, it's like giving a choice to someone, to a child. Would you like an ice cream cone, or would you like to go to the museum? And you'd be surprised at the answers. Okay, we define it as something as part of our learning experience. And that's why my daughter, if that choice was given to her, she would definitely say, I want to go to the museum. Okay, she'd be a little disappointed about not getting the ice cream. I can talk for hours about this point, but quality of life is a method to open doors for the rest to issues and to learning, which they will carry with them the rest of their lives. So my Linda gets taken every Sunday. We do a Sunday outing. We go museums and parks because there's not enough of that in her environment. So I have to supplement it, and I enjoy it too. So thank you for the time, and I appreciate listening and all the work, the hard work everyone here is doing to improve our loved ones' lives. Thank you.
Thank you. Next up is Brendan Klein. You should be able to unmute. Okay, I'm going to move on to Melanie. You should be able to unmute.
Can you hear me?
We can, yep.
Okay, thank you very much. Thank you, Commissioner and committees, for all the wonderful work you do. I'm a mother of a 16-year-old boy with severe cognitive disabilities and intractable epilepsy. He has daily seizures. I wanted to talk a little bit about self-direction. We have been in self-direction for 3 or 4 years now, and it's been a wonderful, wonderful experience, a great improvement in my son's life and our family's life since we started self-direction. I do want to raise some of the issues that we've been having recently with IDGS classes. My son cannot go to a class for his cognitive age. Which would be like a pre-K or kindergarten class to learn something. And there are no classes of that nature that will allow him to attend. And it's simply not possible for him to go to a jewelry making class at the JCC or something like that for what is called the general public. And I did inquire whether perhaps this program is not set up for children like my son, but I was told no, just find another class. But you know, it just isn't possible, and that's kind of the unicorn. There is no other class that my son can go to that is really appropriate, that's absolutely a general public class. And it kind of leads me to the question about community. And my son, who has severe cognitive disabilities, still has a community and still wants to integrate in his community. So currently, this community is very rigidly defined as the general public. I mean, that suggests to me that my son is not part of the general public. I mean, our children are part of the general public. And I think that community needs to be defined in a very person-centered way, which will be individual to each family. And there will be a spectrum of communities that are appropriate for each child with self-direction. So I would ask, there've been many discussions amongst parents like this and very great frustrations in the rigid way that this is formed, and certainly problems since last November with what some of us are calling the shadow ban of many classes that have been banned, seemingly some classes that are run by special needs organizations, even though they are open to all, have been denied. That is just very frustrating, because when you have a child who has so many disabilities, you need people who are very experienced with people like that. You need someone who's not going to panic when your child has a seizure, and is able to move on and continue when they're ready to continue, and so on. So I would just ask that, I know that OPWDD is considering this and figuring out how to move forward with that. But what this means is, in the meantime, my son is sitting at home because there are no classes that he can go to, and he's not integrating in his community anymore. And that is a very sad situation for him. So hopefully we'll be able to make some changes there, and we look forward to that. Thank you again for all your hard work.
I'd like to respond to that because it's certainly something I can identify with. My son also has seizures, and he takes a class, or well, the class comes to him for an organization that has experienced exactly what you're describing. Although they're open to all, not all want to participate in classes with our children. And somehow these organizations, they're being punished as if they're not inclusive of everybody, because they don't have a typical participant for a certain class, and they're being denied the approval for self-direction. And you're right, what the outcome is that then the people that were attending that class are now forced to sit at home with no class. So that is definitely an issue that I've been alerted to, and to hear that you're experiencing it as well upsets me. The other thing I think you're kind of bringing about is also an issue that I've been trying to work on, and will work on, the fact that a lot of the self-direction programs negate if you have the need for, actually this is OPWDD programs as well, day programs, if you have a need for skilled care during the time that you're attending one of these programs. And parents have had to get very, very creative with the participation of OPWDD, but we shouldn't have to jump through hoops like this in order for our complex or medically involved children to attend or participate in programs. So it is something that I certainly am hoping to work on, and I thank you for your comments.
Thank you. The next up, we have Ralph Warren. Ralph, you should be able to unmute. Ralph, you unmuted and then remuted, so I'm just going to try one more time.
Okay, I heard a beep. Can you guys hear me?
We can hear you, yep.
Okay, great. Yes, okay, so I have a specific question for the commissioner. I see she's still here, but my quick comments and questions are really about major topics to the council, and I'll just jump right into it. So I wanted to clarify, I was at the forum, the strategic plan forum on Long Island. I said that the strategic plan is a failure. I did not mean that it's a criticism of any individual OPWD staffer, certainly. The problem is that myself and other advocates for, since the start of the strategic planning, have pointed out other states that do performance measures. We're into this a year now. We did not see anything that's like a performance measure. So the first step of that obviously is data. I should step back and say, I am a self-advocate, been involved with advocacy in these services for maybe 7 years now. Did work in the 90s with program evaluation, research, policy, little policy work with disabilities more generally. So I want to point out what I and others for a couple years now have said is available data or should be available, starting with the medical. And I want to emphasize personally, I have had the same experiences, problems, and share the concerns of the first speaker today about dealing with doctor offices. And we have the right, and now we have regulations in COVID to say that direct support staff should be available to us, with us directly to help us in medical appointments. So managed care. My question at the end will be about what information will be provided to us regarding managed care. So specifically, we had some data that has been the Medicaid claims data for OPWDD services that has been released. It could have been improved on, but what I want to say the committee, the council here should know is that data is also available and should have been made available to us around Medicaid data on basically any kind of medical service and some of the other health-related services that are Medicaid claims data. That certainly should have been available. So, a very simple question, Commissioner, that just can be yes or no. Will that be made available to us during these managed care forums? Next thing I want to just say is that myself and others, so for example, Sue, just on this council, have been very involved with I don't know, going back four years or more, with Department of Health initiatives around value-based payments. So, a number of advocates across the state have been have been involved with work on quality measures from the standpoint of Department of Health initiatives. And we should have an opportunity to be engaged in this process, provide that information to you, try to get involved with the work you do going forward on quality. And then finally, family support, again, a data focus. I'm been involved I'm a member of the Long Island Family Support Advisory Council for about 6 or so years. A number of people are very concerned about the changes with eligibility requirements, so that the end result of that is that it'll be harder for more people to go into the waiver when they are basically school age. That will create a much higher demand for family support services. And I would say that by December, or certainly during the budget presentation from the commissioner, we should hear data about how that demand is expected to change based on data that OPWDD has available to you. So my question is for the forums on managed care, will we have data presented to us about medical claims data utilization along with OPWDD service utilization?
I don't. Traditionally, this is just public comment, right? Not opportunity for dialogue. So I'm going to just defer, I guess. I don't think it would be unfair, Ralph, for me to answer your question and not to dialogue with the other commenters. But I know you know all the different ways to reach us at the agency, and we can have that conversation offline.
Okay, thank you.
All right, thank you. The next person is Roy. And just a reminder, if people are interested in speaking, please raise your hand so I can find you. Just when you raise your hand, press it once and it stays. Or you're unmuted.
My name is Roy Probian. And my wife, Arlene, and I of 50 years were high school sweethearts. Ended up having 3 sons, all of which had autism, which was almost an unknown malady back in the 60s. We visited Willowbrook because institutional settings were all that the other ugly named agency, which is now OPWDD, thank goodness, had to offer. And we were shaken to our core. And we left and pulled over and looked at each other, and we made another vow to keep our sons at home the rest of their lives. And we did. It was a long journey dealing with special ed, which was non-existent in the earlier days. And then the IDEA came in, and then OPWDD, and wended our way with a lot of advocacy for not only our sons through the years, and I'm not going to list my affiliations. It would take us to 2 o'clock. But I've been advocating for them all of our lives, as did Arlene, my wife. And we made it through the process and got services as we needed, sometimes on a timely basis. We were the first family to get approval through the DOB, through the Office of OPWDD, to get support by the family, to the family for our 3 sons' care from an agency back in the day. Unfortunately, CMS came in and decided that was not something that was going to be kept. However, they did grandfather us in. And 12 years ago, my wife passed, God rest my wife. And I retired and wanting to focus on the care of my sons, and I continued my advocacy work efforts, and it grew. And we made progress, continued to make progress. And then, unfortunately, 5 years ago, my son Roy, my eldest son, passed in the house because of the staff's failure to do what he was supposed to do. And then the agency that was serving us at the time for 20 years decided to cancel our residential services that they were providing after he died. And so I ultimately ended up having to choose self-direction service, because while CMS grandfathered our program as a valuable one, it was no longer available through an agency because they had eliminated that former residential service. So that was in 2019. And then I decided to take self-direction because it ultimately became the only thing available. And I became the immediate supervisor of 7 staff in the house. And it's been a constant struggle to recruit and this is the point of my call, to recruit and retain staff because the pay is so low. And I know this is not OPWDD's problem. It's their problem, but it's not your fault, if that's the right word. And we need to get the legislature and the governor to support this population. We're a small population compared to a lot of other people, but OPWDD is trying the best they can. The commissioner has heard the story, so you can leave if you want, Commissioner. We cannot, I'm having trouble hiring people and keeping people. And in the meantime, I'm supervising the staff, and the minimum wage job that they are now being paid is just unconscionable. And the governor knows this because she gave a $6,000 raise to the state DSPs in the prior budget and in this year's budget. So they're now making $24 an hour, and our folks down here in downstate are making a little over $16. So I'm 84 now, and Michael is my last surviving. Oh, I forgot to mention, God bless Glenn. I lost Glenn 2 years ago. In fact, this Sunday will be the anniversary of his passing. And again, because the staff made a bad judgment, and it happened in the house also. Michael, my middle son, is my only surviving son. He's 60, and he's nonverbal, legally blind with profound autism and intellectual disabilities. I really cannot care for him anymore. I need the staff here. But I want to put Michael into a group home, and I have offered, and it has been approved, my own home here in Manorville, Long Island, to become a certified IRA. And the agencies who I've been working with, two of them have not been able to hire staff since 2019 and more recently 2021 because of the terrible salary situation. This workforce crisis is literally a crisis. And I don't know what's going to happen if I die. I'm 84. I happen to be healthy, thank goodness. But if I die, I don't know what's going to happen to Michael. I am terrified to think what might happen. Because my offering of my home is so that he, as legally blind and nonverbal, will at least be in his own home and know where everything is and how to get around, and have the other gentlemen join him. They've been picked and available, but we cannot hire staff. I'm now trying to find another agency to work with. And so it's, and I'm not alone. There are hundreds, I'm sure, of parents who have kept their sons at home. We've done our duty and, you know, and taking care of our sons. And now it's time, and we are not getting this state to do its job. And I don't know, I don't know what you can do any better than the rest of us, but you need to know how crucial it is. We did close Willowbrook as an institution, and the one we had here in Melville, but it really does still exist out here in the diaspora. We're now in homes, family homes, group homes, and day services, and it is just critical. So I don't know what you can do, but I just wanted to make you aware of our story, and someone who's been a longtime advocate for OPWDD services and my son's brothers and sisters with IDD. So I just wanted to tell you one story, one Long Island story of one family who's tried to do the right thing and now are almost abandoned. Not through the fault of OPWDD, I know that, and you should know that. It's the legislature and the governor who abandoned us last year. And I know, Kerry, you have to say what you have to say. Thank you very much.
Thanks, Roy. Rachel?
That's it for online public comment.
Okay, thank you. Right. Well, again, thank you to the public. Thank you to all the members of the DDAC. Thank you to Commissioner and the staff for joining us today. Our next meeting, Rachel, if you could pull that slide up, is I believe November 28th. What day is November 28th?
One second and I'll tell you.
Usually we are on Tuesdays. I think there was a scheduling issue, which today had the meeting land on a Thursday. So again, we will bring the meeting to a close. Thank you all for joining us, and we will see you on November 28th.
Thanks, everyone.
This issue is, our system's gonna crumble if the workforce doesn't